Hey there, Loki here. I would like to share some findings about the COVID-19 statistics, the numbers that we are receiving from the web. Maybe you get them elsewhere than I do, but hopefully the numbers are the same. I know this is not going to be a little silly skit video, no cosplay here. This is a much more serious topic. And there's even though yes we can sort these numbers any way we'd like by total number of cases or by number of deaths. That's very meaningful and interesting, true, but there's something that these numbers don't tell us. It's the ability of each country of coping with its sick, namely to compare the number of deaths to the number of recoveries. That is what interests me. And this column does not exist. So that's what I did. I took all these numbers and I put them in my own spreadsheet here, where I added this extra column here, which I rather forebodingly called the danger ratio. What is that ratio? Well, it's simply these two columns here, which I have highlighted. You can look at my formula here. Simply the number of deaths compared to the number of recoveries. So yes, it's a ratio. And that I think should tell us which country is dealing with its sick better than others. Um, of course, these numbers are not perfect. Some countries are simply slower than others at reporting its recoveries. And some countries are more rural than others, and therefore we cannot truly trust the data. Maybe some people are getting sick out there, way out in a little village. Some people are getting sick on their own, and they're recovering on their own, or they are dying on their own, and nobody ever gets to know about that data. So some of these countries, we can't really conclude anything from that. Yes, so let's look at the list right now. Of course, at the top of the list, we have a bunch of countries where the ratio is 0, obviously. No deaths compared to, well, it doesn't matter how many are recovered, 0 deaths over anything is always going to be 0. So I sorted all the countries by the danger ratio, firstly, and secondarily by the recoveries. So therefore, Qatar is our grand winner here. No danger and 33 recoveries. So good for Qatar. And now, why is a country faring better than another? Well, now that could be a whole different topic. Maybe the infrastructure is better. Maybe the people are respecting the quarantine better than other countries. Maybe it's simply a matter of genetics. Who knows? Maybe one population is just by sheer luck, better equipped at dealing with this virus than another. Who knows? There's a whole bunch of reasons. Maybe if we look at here, a country like Bahrain here with an excellent ratio. It is the best ratio that is not a 0, 0.012. Well, Bahrain is an island country, so again, maybe being isolated on an island is a reason why the situation is better over there. Only 2 deaths over 164 recoveries. Anyways, going down the list, you'll notice something. See, there's China. There's China 40th, well, 41st, but my first row here is the header, so really 41st means 40th. So China is 40th with an excellent ratio. 3,000 deaths, that is tremendous, yes, but 72,000 recoveries, so that's really not bad. That is an excellent ratio. But and there's Canada, my country right here, is also doing very good, 0.012 recovery ratio. But what I want to say is this table is not perfect. It's a bit skewed. We have countries where there's very little data. In Azerbaijan, look at that, only 72 cases, 1 death, 10 recoveries. That doesn't really mean much. There's too little data. Look at that. 1, 5. Look at that. In Jamaica, only 19 cases across the whole country. We can't really deduce anything from that. So that country shouldn't be this low on the list because it has so little data. So this table is not really representative. It needs to be normalized, and that's what I did here. I have another spreadsheet. We'll look at that in a second. But let's quickly go down the rest of this list. So yes, as we noticed, China, the country where all the attention is focused, it's really not that high. The ratio is excellent, and look at that. The ratio is getting a little worse here. And here's Italy. Italy, the situation is terrible over there. We know that, but it's not as bad as it could be. The ratio is still below 1. 6,000 deaths, yes, but over 7,000 recoveries. So it's almost 1. What this is trying to say is if the whole country gets infected, then logically there will be less than half of the population that will die. That's obviously horrible. That's a horrible thought. But it could be worse. It could be worse. If the ratio were above 1, if the ratio were, I don't know, 3 or 4 or 5, then obviously that would mean that the entire population, if it gets infected, that means that 3/4 or 80% of the population would get wiped out. That would be much worse. Here we're looking at half. Obviously we don't want that to happen, but it could be worse. And here I am trying to be pragmatic about it. There we go. There's Italy. Over 110 countries. Italy is only 79th. But again, I repeat, this is not the best list. We'll look at my normalized list in a second. Now the ratio is getting above 1 now. Now these countries are not doing too well at all. And there's the US of A. There they are. The ratio is double that of Italy. So the situation looks worse in the US, and no wonder it is lower in the list. It is 94th. So 517 deaths, only 300 recoveries. That's why the ratio looks so bad. So what's going on there? Why are people dying so much? I don't know. But America, yeah, things are looking grim over there, with a lot of cases. And here we are coming down at the end of the list. There's Brazil and Denmark. What's going on? What's going over there? Well, 34 deaths and 24 deaths, and only 2 or 1 recoveries for a terrible ratio of 17 and 24. That's horrible. What's going on? Well, hopefully it's simply that they're being conservative. There are people over there that are hopefully on their way to recovery. The health system over there simply has not reported them as being recovered. And hopefully that's what's going on in the Netherlands. The worst country, according to my calculation, because they have 213 deaths and only 2 recoveries. So hopefully that's the same situation. They're just being conservative. Hopefully the real situation is more like, I don't know, 600 recoveries. Look at that. The ratio now is looking a lot better now. So hopefully that's what's going on, because as things stand, they have a ratio of 106.5. It's in a class all of its own. There's nothing even close to it. So that is absolutely horrible. So now before we jump to my other normalized table, let's look at what's going on below my little gray line. Well, these are countries where there are no recoveries. So a ratio of anything over 0, we end up with, a division by 0. So we can't conclude anything from that. And the reason is, well, for most of the cases, there's no data. There's virtually no data. So look at that. In Vatican City, there's 1 case. Hopefully it's not the Pope. So look at that. So we can't conclude anything from these countries. No deaths, no recoveries, or 1 death, no recovery. So the illness just has not made it to these countries, or if it has, is just not being reported. So we can't conclude anything from those countries. Best not to talk about them at all, except for this one right here, except for Turkey. Uh, if we concluded that Brazil and Denmark deserved our attention, it's a little worrisome what's going on over there. If we concluded that, then shouldn't the same be said for Turkey? Look at that. For Brazil, 34 deaths, 2 recoveries. Turkey has 37 deaths and no recoveries. Those are almost identical. Those are almost the same numbers. So logically, if Brazil and Denmark deserve our attention, so does Turkey. So let's keep an eye on those countries, including Turkey, in the coming days. And by the way, this data dates from March 23rd. Today is March 24th. This data dates back from yesterday. So I will make updates of this data in the coming days. If you thought that this was interesting and meaningful, I'll be sure to make some updates. But now let's jump right into the meat of it, the truly meaningful table, my normalized data. Now what have I done here? I've added an extra column. I've simply multiplied the ratio, the danger ratio, by the number of cases. So this should give more weight to the countries with more cases. So we had Jamaica earlier. I don't know where. There it is. Jamaica was what 75th or something like that. 79th. I forget. It was bad. There it is. It was the 71st. That was bad. It should not have been that bad with so few cases. So there we go. Now it is merely 35th, as it should be. So by multiplying its ratio of 0.5 by 19, we only have 9.5. There we go. That's where it should be. Fewer cases, you belong higher up on the list, and that's what we have here. I've sorted by my normalized danger primarily, and secondarily by the number of cases. That's why Saudi Arabia now jumps as the number one, as the best country according to my normalized ratio here. So China, which used to be 40th, it's not here anymore. You'll see, it's much lower, much lower. There's the Diamond Princess, that boat in quarantine off the coast of Japan, which if there will be a movie made out of this one day, you can bet on that. And my prediction is that the movie will be called Diamond Princess. It's just there's a story to tell about that. I'm sure it fascinates me. Canada, which used to be 44th, is now, there we go, is now 67th. So normalized, the Canada is a little lower, as it should be, even though we have an excellent ratio, an excellent recovery ratio. 2,000 cases does lend the situation some weight, which is why Canada went down on the list. And look at that. See, the lower we go, usually the higher the numbers are. And here's something interesting. South Korea. For a country with so many cases, South Korea, it really is not doing that bad. Yes, it is 81st on the list, but the ratio is so good that these 9,000 cases are only given a normalized quote here of 314. So not bad. So South Korea seems to be handling the situation rather well. What about North Korea? You can see that it is not present on the list. Obviously, we have no data whatsoever about our favorite dictatorship here. My prediction is that the situation is not that bad in North Korea. Maybe it has quite a few deaths, yes, but there are few cases. Why? Because when the government imposes a quarantine on the population listens. Let me tell you something, when they get told something, it's in their best interest to do what they are told. That's what a dictatorship is all about. So maybe quite a few deaths in North Korea, but a very small spread of the disease over there. Maybe we'll never know, maybe we'll never have any information about that. So now we're getting into the big losers here. As you can tell, all the countries that are left at the bottom of the list here are countries with high number of cases. That is the beauty of my system of multiplying the danger by the total number of cases. So we don't have any pollution countries that really shouldn't be here. And there's China, 95th in the list. So this is a bit more representative, even though the situation seems to be all but over there. Out of the 81,000 cases, 3,000 have died, 72, nearly 3 have recovered. So the situation is all but over there. Still, it deserves to be low on the list, and my calculations do that, giving it a 3,600. Normalized stat. And now look what's going on here. France, Germany, good ratio, but so many cases that these countries still should be low on the list, and they are. And the UK also, things are not going very well either. The ratio is pretty high, very high. And there's Spain. Our good friends Brazil and Denmark are still high, but they were in the top 3 earlier. Now they are being beaten by by Italy and the US. Yes, that's exactly where those two countries should be. They are respectively number 3 and number 2. So once again, my numbers agree with my personal assessment. The situation in the US is worse than in Italy, because the ratio is worse than in Italy, and the number of cases is really fairly close. So by multiplying this with that, in Italy we get 52,000, and in the US we get a whopping 74,000. But that's still nothing compared to the Netherlands. The Netherlands has 10 times fewer cases than the US. Well, that should certainly help its normalized danger. Oh, it does, but not nearly enough to make up for the 106 ratio. And therefore, it still has a 505,000 normalized ratio stats. So yes, so what's going on in the Netherlands? I don't know. So again, hopefully it's simply because they have not given us updated numbers of recoveries. That must be the case. So so there you have it. Let me know if you thought that this was meaningful, interesting, or if I'm way off in my assessment. I'll be sure to update the situation. Because once again, this data dates from yesterday, March 23rd. Already today, I'm curious to know if the numbers have changed drastically. I'll be sure to do a follow-up in the coming tomorrow and 2-3 days. I don't know, but let's keep an eye on these two columns right here, which is what you do not get from this online list. All right, well, Loki tells you to stay safe, stay isolated, respect the quarantine if one is in effect in your country. If one is not in effect, then there's nothing wrong with imposing one on yourself. It's for the best. So stay healthy physically, but also mentally. This all this isolation can get a little hard on some of us. A cabin fever can start to to make itself felt. Take care of yourself, and I'll see you guys later. Bye bye.